Respiratory system. Primary function: provide oxygen to the cell for metabolism, remove carbon dioxide and other waste products of metabolism. Secondary functions: humidification and filtration of air, voice production, maintain acid-base balance, temperature maintenance. Anatomy of respiratory system. Upper respiratory tract, it includes nose, sinus, pharynx, larynx and the part of glottis is helping for coughing reflex and the glottis. Lower respiratory tracts it contain trachea, cardia, bronchi, bronchioles, alveoli, lungs, pleural cavity. Location according to vertebral column 36T5, length approximately 10 to 12 cm. Cardia, the point in which trachea divided into right and left mainstem bronchi in carni. Bronchi, right bronchioles are larger than left. Bronchioles, not helping for gas exchange. Alveoli, it is a grape-like structure helping for gas exchange. The distal portion of alveolar to bronchioles is known as pleural acme. Type 2 alveolar cells is producing surfactant. Without surfactant, the lungs would be collapsed. Lungs. Right lung is larger than left because of accommodate heart in the left side of the thoracic cavity. Right lungs has 3 lobes and left lung has 2 lobes. The upper lobe of lung having too much air circulation and a lower lung of lobe containing blood circulation. Pleural cavity. Covering of lungs. Outer layer parietal pleura and the inner layer visceral pleura. In between pleura fluid present. Respiratory nerves. Phrenic nerve, vagus nerve, thoracic nerve. Respiratory muscles are splena muscle which elevate the first two rods. Sternocleidoid mastoid muscles. Sternocleidoid mastoid muscle which elevate the sternum. Trapezius and pectoralis muscles. Trapezius and pectoralis muscle which fix the shoulder during the time of respiration. Physical examination of respiratory system include inspection, palpation, percussion, auscultation. Inspection. Monitor any abnormal chest sounds. Ballot chest. Ballot chest means anterior and posterior diameter of the chest increases. Example: emphysema and COPD. Funnel chest or concave chest. Pectus excavatum. Funnel chest, it is a condition in which the breastbone shrink into the chest. The causes are genetic, Neon syndrome and Marfan syndrome. Pigeon chest, pectus carinatum or convex chest. It is a malformation of the chest characterized by a protrusion of the sternum and ribs. The causes are rickets, poor controlled asthma and scoliosis. The clinical features are clubbing figures, jugular vein distension, retraction, nasal flarynx, paradoxical movement. Once again repeated, what are the abnormal chest? Barrel chest, funnel chest or concave chest or pectus excavatum. Pigeon chest is another type of abnormal chest. Pigeon chest, another name is pectus carinatum or convex chest. On palpation, crepitation present, tracheal deviation, tracheal phimosis. It is increased in pneumonia and decreased in pneumothorax and pleural effusion. Vocal phimosis. Vibration feeling increased in pneumonia and decreased in COPD. Tussiphremetus. It is vibration felt on the chest when the patient coughs. On palpation, it is non-mandatory. Crepitations present. Tracheal deviation or Tactile fremitus is present, maybe it chance to increase in pneumonia patients and decrease in pneumothorax and pleural effusion. Vocal fremitus means it is vibrating feeling increased in pneumonia and decreased in COPD. 2C fremitus, a vibration felt on the chest when the patient coughs. On percussion, resonance feeling, dull or flat sound. If fluid is present, we can hear dull or flat sound. Hyperresonance or tympanic, if a patient has gas in occur, excessive gas in occur, tympanic sound. These are seen on a percussion. We can getting these findings. And also auscultation. Auscultation, normal breath sounds are normal rhythm and depth. You and bronchia, a bronchial air passing through the terminal trachea and bronchi. Bronchovesicular air is passing through the bronchioles. Vesicular means it is air is passing through the alveolar. This we have to hear the distal area of the chest. Adventitious breath sound or abnormal breath sound. We will discuss what are the adventitious breath sound or abnormal breath sound. Stridor. Stridor means it is harsh, vibrating, shrill sound produced during respiration. Where is completely airway obstruction. Managemental intubation or tracheotomy. Stridor. Stridor means it is a harsh, vibrating, shrill sound produced during respiration. Stridor means it is a harsh, vibrating, shrill sound produced during respiration. There is completely airway obstruction. Management, intubation or tracheotomy. Wheezes. A musical sound or whistling sound commonly heard during expiration when air is passing through the partial obstructed air passage. Example, asthma. Wheezing. Wheezing means a musical sound or whistling sound heard during expiration when air is passing through the partial obstructed airway passage. Example, asthma. Management of wheezing, bronchodilators. We will give the patients bronchodilators. Beta 2 antagonist. Example, salbutamol, terbutaline. Adverse effects are tachycardia, palpitation, tremor, sweating, anxiety, insomnia, arrhythmias, hypokalemia. Next, methyl xanthines. Methyl xanthines include theophylline. Side effects are tachycardia, headache, insomnia, dizziness, hypokalemia. Antidote, beta blocker. Methyl xanthine antidote, beta blockers. Crackles. Crackles means sound heard when air is passing through fluid-filled alveoli. Example, pulmonary edema. Crackle sound is heard when air is passing through fluid-filled air alveoli. Once again, I will repeat. Crackles. Crackles means sound heard when air is passing through fluid-filled alveoli. Example, pulmonary edema. What are the most seen in clinical manifestation? In crackle sound commonly present in cyanosis. Management of diuretics and mechanical ventilation. Friction rub. Friction rub heard in pleurisy. Clinical manifestation are knife-like chest pain during respiration. Friction rub it heard in pleurisy. Knife-like chest pain during respiration. Whilst respiration or pooping sound. Heard condition in TB. Common diagnostic test. Next, we will discuss common respiratory diagnostic tests are chest X-ray, suctioning, bronchoscopy. Chest X-ray. It is remove the metal object or jewelers for the area. When you take chest X-ray, you should remove the all metal objects or jewelries for the area. If a female chest coming for X-ray, ask the client regarding any possibilities of pregnancy. If any female client coming for chest ray, ask the client regarding any possibility of pregnancy. Instruct the client to practice Valsalva maneuver. That means take a deep breath and hold it. Instruct the client to practice Valsalva maneuver. During sputum collection, but for identify the microorganism, sputum culture is another type of diagnostic test. We can take the sample in early morning specimen. It is best sample time. The collection of sample is we will take in early morning specimen. Collect minimum 50 ml sputum in a sterile container. Specimens should be collected before starting antibiotic. Most appropriate method is if you take specimen, you should collect before starting any antibiotic course. Before specimen collection, instruct the client to take deep breath followed by a coffee for getting adequate amount of sputum. Before specimen collection, instruct the client to take several deep breaths followed by coffee for getting adequate amount of sputum. Before specimen collection, instruct the client to avoid clean the mouth with antibiotic solutions or Colgate brushing, but can clean the plain water. Before specimen collection, to instruct the client to avoid usage of any antibiotic lotion to clean your mouth or Colgate, but can clean with the plain water. Suctioning. It is another type of technique. Suctioning. Before suctioning, hyperventilate the client. Before suctioning, hyperventilate the client. Duration of the suctioning is 10 seconds, not exceed more than 15 seconds. Duration 10 seconds, not exceed more than 15 seconds. After few seconds, the client develop coughing or cyanosis. Stop suctioning and administer oxygen. Tracheotomy suctioning. Insert 10 cm suction catheter for nasal suctioning up to pharynx. Bronchoscopy. It is visualization of larynx, trachea and bronchi with the help of a fiber optic bronchoscope. Pre-production intervention. Consent. Take a consent. It is taken by a doctor. Monitor coagulation report. Before doing this bronchoscopy procedure, we should monitor coagulation report, PT, APTT, INR. Midnight onwards, NBO is needed. Keep all life-saving equipments at the bedside. Post-procedure intervention. Priority for airway and vital signs monitoring. Post-procedure intervention is prioritized for airway and vital signs monitoring. Semi-Fowler's position. We should provide the patient after bronchoscopy. We will provide semi-Fowler's position. Put the client for NBO till gag reflex return. Put the client for NBO till gag reflex return. Monitor if the patient has any complications.